Hello, my name is Alice Villalobos and I am a DVM from UC Davis, and I'm also a distinguished practitioner in the National Academies of Practice. My area of expertise is oncology, and I've been practicing oncology for over 40 years and am considered a leader in the field. And at this point in my career, I have been really interested in end-of-life care for oncology patients. And so many of my referrals are animals that have been diagnosed with very advanced stage cancer. Many of them, as you know, are older and they have osteoarthritis. And my interest with using the ML830 Cold Laser is to see if I can bring some pain relief to my patients. And then also I'm very curious to see what field we can, maybe apply laser to cancer cells directly. Now we all know that increasing or dilating blood vessels in tumor tissue is not, does not sound like a good idea. But in certain palliative cases where we know the patient has progressive and advanced disease, it may be that we're not making any difference so far as enhancing the tumor or the progression of the tumor. And I have certain patients in mind that have bone cancer, and this is the first tumor I will deal with because it's the most painful one. And I've been talking to some of the owners of the animals who are being treated, and at a certain point in time, if they feel and if I feel it is appropriate to use the laser to see if we can bring them pain relief to bone cancer, we will do that and see if we can make a difference. But I'm also going to monitor the patient after the laser therapy to see if we feel that we've enhanced the metastases or the growth of the tumor itself. We'll be measuring the tumor tissue directly, and then also we'll probably have chest filmed before and then maybe several weeks later to see if we've actually got a growth spurt. This will be very interesting, and it wouldn't surprise me if we did, but again, it may not make any difference really in these particular patients because they're so advanced, and we often may not want to be giving them powerful pain medications, and we may have that advantage with the laser. I would just say that in my other cancer patients, I've been using the laser for instance, one particular case, Buddy, who has a severely enlarged mast cell tumor on his leg. And the mast cell cancer is very common in dogs, and in fact it's the most common killer of skin tumors in dogs. It releases histamine from the cancer cells and also other vasoactive amines that can cause shock and edema. So of course we would never use the laser on the tumor tissue for this dog, but Buddy could not walk for about 2 months. And he has the most severe osteoarthritis and calcification of his knees and his elbows and along the entire spinal cord. So we actually gave him 9 joules of energy into the most obvious ports for his knees and his elbows and along his back. And that's when he started to really improve. And now he's even climbing up and down the stairs, and the family is thrilled. Buddy is in end-of-life care, and we're hoping that he will do well for quite a while. But I'm going to be relating my findings so far as my bone cancer patients to my colleagues and also human oncologists who are interested in this information. Thank you.